Hello, and welcome to my podcast on ADHD in Education. My name is Hadley John, and today I will be interviewing 3 students who have ADHD. The purpose of this podcast is to bring awareness to future and current educators about how different ways that they treat and teach their students with ADHD have an impact on these students' educational experiences and well-being. So Avery, how did your being tested for ADHD come about?
I think it was 3rd grade. I started daydreaming a lot in class and not paying attention at all. And it became a problem for my studies and stuff. So the teacher told my grandma hey, she's not paying attention in class. And she took me to a therapist, and he was like, yeah, I could put you on some medication for ADHD, and that's basically how that started.
So Katie, how did your being diagnosed with ADHD come about?
That's a great question. It was kind of a fluke. My sister was having a really hard time with a lot of her writing assignments, especially at home, and it was a big battle between them and my mom. And my mom wanted to get them tested for dysgraphia. But in order to test for dysgraphia, you have to test for ADHD first to rule that out. What happened is I think we were at a doctor's appointment together, and so they were going to be tested. And so my mom was just like, well, Katie can't turn in her homework, so why don't we just test her too and see what happens. And at that point, our pediatrician was using something called the quotient test. I don't know if people still use it. I think most people, especially psychologists, will usually use a questionnaire. But the quotient test was a really quantitative measure for ADHD. So they had you sit in a room looking at a screen for 20 minutes if you were younger, 30 minutes if you were older. And you would hit the space bar every time a star flashed on the screen during this 20 or 30-minute session. There was also a headband that you wore that would track head movement. So I took this test, and I was like, well, I'll just, I'll stay really still, and so it won't track any head movement. But it's a great test for ADHD because it has you sit for a long period of time. It tests so that, that's just, can you sit still and focus on this task for 20 or 30 minutes? You have to not push the space bar every single time something flashes. You have to discern whether it was a star or a circle. So it tests for impulsivity. And then the headband also kind of tests for hyperactivity. And probably 10 minutes in, I was getting kind of wiggly. And when I got diagnosed with ADD. At that point, it was still separate. I was not diagnosed with the hyperactivity part. But I was getting a little wiggly, and I was like, well, I'll just keep my head still. And I don't know if this is part of the experiment or not, but they put me in a spinny chair. It was a wheelie spinny chair. And so I was like, I'll just move my hips. I won't move my head. I'll keep my head still. But that little sucker headband caught every little movement I made towards the end of that thing. And the way that it quantified it was on a scale of 0 to 1. So 0 to 0.5 was not ADHD, and 0.5 to 1 was ADHD. And I was rated at a 0.74. And for the record, I am in 8th grade at this point. I was late to be diagnosed by some standards and early by others. So I think I was 13 or 14 at the time.
Okay, yeah, it's really funny that they had you sit down for a long period of time, because the study actually found that most parents start realizing that their kid may have ADHD after they begin formal schooling.
Yes.
Because that's when they're supposed to sit and do an activity for a long amount of time.
Yeah, you usually can't be diagnosed until you're at least 6 because they want to see, what it looks like in a school setting for you.
Oh, yeah, definitely. So that's kind of funny, though, that, you weren't the one who was supposed to be tested.
Oh, yeah. They were just like, see what happens with her. And I was like, oh, there's a little bit more going on here than we thought.
Did you think that the outcome would be like that?
I had no idea. I'm not even sure I fully knew what was going on. I don't know if I think I knew I was being tested for ADHD, but I had no idea what that meant.
Yeah.
So I didn't know. I did not really know.
What was your biggest challenge as a child with ADHD in school?
I think it was just mostly for me, paying attention. I think my ADHD, I learned about it actually in my abnormal psych class a few days ago. I feel like I think mine was less hyperactive and more intentive ADHD. Inattentive,
Mm-hmm.
yeah. Because I wasn't like super hyper, like I was about the same energy levels as any other kid, but like for some reason it was so hard for me to focus. So
Okay. So you just had a hard time like focusing.
yeah, it was. My brain would go everywhere. Like I remember third grade was also the year even with the medication, that was also the year I had my first like standardized test. We called it EOG back in like elementary school. I was the last person to finish because I could not focus, and it was just so difficult for me in general. I'm not sure if it has anything to do with ADHD, but I feel like it had a factor in it for sure.
Yeah, I mean, I would think so, like if it took you a long time. What was your biggest challenge as a child with ADHD in school?
Ooh. Homework. Immediately homework. My observations from myself and other people with ADHD is that homework really starts to be an issue after third grade. But I was crying at the kitchen table trying to do math homework with my dad in first grade. So homework has always been the biggest thing for me. I think it's a combination of having to just sit and do something that you're not motivated to do, and maybe not having some kind of skills. I've always felt better with some kind of support, but even in first grade, I'm crying over homework with my dad.
Yeah, that's pretty early on.
Mm-hmm.
So it was like hard to get like the motivation to keep going.
Yeah, I was motivation is the number one thing for me from elementary and middle school, for sure. Possibly high school as well, but I mean, for the longest time, I would have called it a motivation disorder if that was even a thing.
How did teachers make you feel in regard to your ADHD?
So elementary school teachers had no idea. I was never treated differently for ADHD that anybody knew of. Frankly, ever, because even after I got diagnosed, we didn't really do much with that information. I got on medication, and that was it. So my teachers did not know I had ADHD unless I told them, or if they did, they didn't say anything. I was treated as a gifted kid who had, was not living up to their potential. I got that a lot. The work you do is so good. Why can't you just do it all the time? Or I was talking too much. I was very talkative. I did not get in trouble for behavior issues other than talking too much. Just wasn't totally talking out of turn. I'm sure I had a lot of irrelevant things to say. I don't think I ever raised my hand to say my favorite color is purple, but I know that just talking was the big one for me.
According to a study, males are considerably more likely to be diagnosed with ADHD than females.
Mm-hmm.
Do you feel like you relate to this, or you've seen this, anything like that?
So I'd have to definitely say that the research is totally changing. Based on research studies like that say males are way more likely to be diagnosed with ADHD. People have really, in the last 10 years, have done a lot more with ADHD research as it pertains to girls. Because they have noticed that trend, they're starting to look more into girls. And I know, my mom, for a while, worked for a pediatric neurologist and administered the quotient test to diagnose people with ADHD. And she had done that for almost 5 years before I had gotten diagnosed. And we still, had no idea. My mom was like, how did I not pick up on this? I'm, working with these kids every single day. How did I not notice? I was like, Mom, psychology didn't know. I mean, somebody probably did, but a lot of the research, like ADHD was so in the literature, just can't sit still disorder for so long. It's really starting to change now. But I've spent like since I graduated high school, I've done a lot of anytime I had like a research project to do in my college classes, I almost always did it on ADHD if I could. Like it's become my hyperfocus. My own ADHD has become my ADHD symptom hyperfocus. So I would say, people say boys are more likely to be the ones bouncing off the walls and girls are more likely to be inattentive, daydreaming, which is why girls are more likely. Again, that's one reason, like, it's really good that we actually consolidated and just, like, all of its ADHD, because it was more likely for girls to be diagnosed with ADD and boys to be diagnosed with ADHD, because only the boys were the ones bouncing off the walls. And again, it's not just that. It's hyperactivity presents differently in different people.
Oh, yeah.
Every symptom of ADHD, it comes up differently for different people.
How did teachers make you feel in regard to your ADHD?
I'll be honest, not a lot of them really commented on it. I think the only people who did, like, somewhat mention it were those teachers in third grade. Basically, they asked after I, like, went to therapy and stuff, they were told that I started medication. And they asked me, like, oh, are you on medication? And I was like, yeah. And that's really about it. I don't know if my other teachers ever knew I had it. I'm not sure if it's in my school record or anything like that. Some of them did not accommodate for it whatsoever, though, I will say. And I'm hoping that they didn't know instead of knew and just didn't care, because it was a mess.
So how did they, like, not accommodate to it?
Well, for me, like, especially, like, in math, my ADHD goes, like, through the roof for some reason, because it's also, like, not a preferred activity for my brain, and whenever it's something not preferred, my brain is like, no, let's not do it, and, like, it's like a brick wall in front of me, kind of like, it's just even harder for me to do it and, like, start it and complete it and all this stuff. And in 8th grade, I had, like, a math class, and she sat me in the middle of a bunch of, like, really talkative guys. And I told her, I was like, hey, I can't focus at all already, but they are making it even worse. And she was like, okay, like, I'll move you. But she didn't move me for, like, a month or two, and it was the absolute worst. Like, it made it even worse for me, and, yeah.
So it sounds like there were times where you, like, vocalized, like you said, hey, this is what I'm struggling with. Like, can you accommodate? Can you help me with this? And they were like, yeah. And then they didn't do it for a very long time.
Yeah.
Setting clear, achievable goals for students with ADHD is another great way to make them feel successful, since making decisions is something that they can struggle with due to impulsivity. How do teachers make you feel successful, and how do they make you feel unsuccessful?
What made me feel unsuccessful, and I can name it now because I have done so much looking into this, is that partially because people did not know it was ADHD, partially because people did not know how comprehensive ADHD was, and partially because I was just seen as the gifted student who was not living up to her potential. People made me feel unsuccessful when they made it seem like it was all my fault, all my responsibility. But in college, the thing that has made me the most successful has been being able to just go in and meet with a teacher at the beginning of the semester to discuss disability accommodations. Not even the specific accommodations themselves, just the ability to say, hey, this is what I have going on with me. This is how it has affected me so far. This is what might happen throughout the semester. If this happens, I've got it. If I have a dip in the middle of the semester, I'm able to get it back up because I have before. So that halfway through the semester, I'm not saying, actually, I couldn't get my homework done because I have depression. Like, nobody wants to go into a meeting with their professor and say that. So just being able to say, at the beginning to start off on the right foot. I have ADHD. It is something I have been working through for a very long time. Here's how it affects my schoolwork. It's not just that I can't focus on it. It's that I struggle really hard with drafting because I don't want to draft, edit, and revise. It's too many steps. I want to go to the final draft and just have it done with. But then I can't do it if it's not perfect. I can't turn it in if it's not perfect. I only get 100 if I'm perfect. So but honestly, just being able to acknowledge the limitations, and then especially Meredith's education department has been really good about saying, okay, what do you need? I don't always know, but I know that because they're educators and they're learning about this, that they're at least open to what do you need, and that we'll be able to work something out. So that's a very long-winded answer to the what makes you feel successful or unsuccessful question.
No, but that's so valuable that you've been able to get these accommodations and go in from the beginning and tell professors that you need these accommodations, because that's just something you very rarely see in grade school that I feel like should be much more normalized. And, it shouldn't have taken until your second year in college to know that you could get accommodations.
Yeah, I don't have an accommodation for sitting at the front of the class. That is something that's available. But it's something that I've done for myself in college is I'll just get there early enough on the first day of classes that I get to sit at the front. I don't necessarily need to be like, oh, she has to be away from a window or she'll get distracted. But I know what I need, and so I can just put myself at the front of the class.
How did teachers make you feel successful? How did they make you feel unsuccessful?
I can definitely tell you how they made me feel not successful for sure. Sometimes in class, like, even though teachers would explain it thoroughly, I'd still need them to say it again because it's harder for me to process sometimes. And sometimes they'd be like, well, I just explained it, why, were you not listening? Or I'd ask questions and they'd be like, well, we don't have much time and it's only you who's, not getting it. So we need to move on for time's sake. And it's just oh, okay. I just won't know what's going on. Thank you.
So it sounds like just having more patience with you. And also, do you think having both verbal and written directions would have helped you?
Yeah, and then also for me, visual examples help a lot. If you guide me through what's going on and then also show me what's going on, I can go about it a lot better because with verbal for me, sometimes I forget exactly what people say. And so if it's written down or there's a picture of an example that I'm oh, it's this, instead of trying to rack my brain and remember exactly what they said.
Okay, yeah. I feel like that's definitely something that goes along with the idea of teachers seeing students as individuals and what they need as an individual rather than the whole class. Oh, I already explained it to the whole class. I'm not going to explain it to you again. I feel like it's as easy as saying okay and then saying okay, class, you know what to do, and then going up to you specifically and kneeling down and being okay, so this is what you need to do.
Yeah, that would have been so much better
because that doesn't impact the class. Yeah,
no, it was basically a time sake type thing, and I guess they could tell everybody else was God, can we just get through this? Oh my gosh.
So bullet points or 1, 2, 3, those will help you more than just a paragraph or something.
Yes. Oh my god, that was always the anytime any written question is in bullet points, I'm over the moon happy because I could highlight the parts and stuff, but just having it there helps so much just to be to remind myself of what needs to be in there, because sometimes I need to write it off to the side anyway, or highlight the parts that need to be put into whatever I'm writing. But if it's already there, that is God sent from heaven, for me personally.
Yeah, we learned in class that doing that and keeping your instructions as concise as possible, like trying to make it as like simple as possible, like really helps, especially like the younger kids, because they can't, their brain can't remember like a whole bunch of instructions and like
even without ADHD, it's like you have to be very thorough and clear.
And like your short-term memory like can't process more than like what, like seven things at a time, something that. So yeah. The Classroom Management Strategies questionnaire requires teachers to 1. Read a brief description of symptoms that children with ADHD often exhibit. 2. Apply this to a student they teach. And lastly, 3. Rate how frequently they use this strategy and its effectiveness in reducing the problem behavior that the child exhibits for each item on the questionnaire. One of the items on the Classroom Management Strategies questionnaire is, quote, assign seating with the least distraction, end quote. Some examples given of this would be either seating the student near the teacher or away from certain classmates. Given this, I'm curious if the students in my podcast have ever had a teacher who assigned seating for them that provided the least distraction.
Yeah, it was either assigned seats or a free-for-all that we're sticking to for the rest of the year. And I don't remember how it went for middle school. Like, I guess it was fine because I made it here. But I know now the value of sitting at the front for me. Some people like need to sit at the back, need to be able to process. The one disadvantage of sitting at the front of the class for me is that I can't see people behind me if they're raising their hands. So I don't know if anybody else has something to contribute. And I am the student who, if the teacher's like, is anybody going to respond to my question? I will make something up. I will contribute. I will say something. And in fact, like, once I hear it's time to hear from somebody else, I realize it's almost like there's like a tally mark in a teacher's head of the number of times that you're allowed to talk. And I am acutely aware of when I have hit my quota for the day and I'm not allowed to talk anymore. The problem with that is I will check out at that point. If I'm no longer able to engage in that class because other students need a turn, I check out. That's not anybody's fault, you know. Everybody in the class should be participating. But especially in education classes at Meredith, there's a lot more like, turn to your partner, let's work with the group here. And so there's more opportunities for dialogue. But in a lecture or in a part of a class where there is a lecture or just even a back and forth, if I have hit my quota, I'm probably out for the day. So I wonder every day how it would have been different if people had known when I was in elementary school. So I wonder what would have been different with seating.
Yeah, so it sounds like the classes where you're able to like engage and participate a lot are really beneficial to you because you don't have to do that tally mark thing as much. Yeah. According to a study, approximately 56% to 76% of elementary school-aged children with ADHD have no reciprocated friendships within their classroom. Comparatively, 10% to 32% of their peers without ADHD face this issue. This means that approximately half to 3/4 of elementary-age students with ADHD do not have reciprocated friendships. Part of being a teacher is helping students form a sense of connection with their peers and to help give them a sense of belonging in the classroom. Given these statistics, I'm curious to see if any of the students in my podcast had issues with making friends and if they ever had teachers who made an effort to help them make friends. Do you feel that having ADHD impacted your ability to make friends as a child? I know, like...
Oh, yeah.
Yeah? Okay.
Yeah, oh, my gosh. So this one's just my experience. I have not... it's so interesting because, you know, I'm also a psychology major. I'm an education major. So I am looking at not only ADHD in the classroom, but I'm looking at ADHD itself. And you look at diagnostic criteria, and it's like, does your child with ADHD have friends? And it's so weird to me. But for me, It wasn't that I never made any friends. It was that I was never in a friend group. I remember being aware of this, but it was like friend group A, B, C, D, E. I was never in any of those groups, but I usually had one friend in each group. That didn't necessarily help you from feeling like an outsider, but I had my friends. I had people, and I wished to be in those groups. I was like, I knew that that's the group of cool kids whose favorite color is blue and they actually like running the mile. I wish I was friends with them, but I don't like running the mile and my favorite color is pink. So, and then in middle school, I had a really great friend group. But we were all the weird kids, right? And I don't know how like appropriate. I don't like other people might have like issues with this, but the way I saw my social standing in middle school, like so middle school was when I became acutely aware of social hierarchy in general. Like here's the preppy kids, they're popular, they're on top, they're on student council. In 2011 to 2014, it was these big giant bows on the side of the hair. It was the Ugg boots and the Toms. Like that's what it was. And I was not any of that. I got $20 Ugg knockoffs. I did not do the bow thing. I did like the headband thing. There was a headband thing for a little bit. So it's like having ADHD, it's more like being an observer of what's going on and having some obstacle to fitting into that.
In a study, it was found that children who used fidget spinners exhibited poorer attention. On the contrary, another study has shown that using fidget spinners increases on-task behavior. Given this, I wonder if the participants feel that they benefited from using fidget spinners or not. So earlier you had talked about using like fidget poppers. So do you have any like experience with that like during like grade school, or did you have any teachers who supported that?
In my educational experience, there were no fidgets offered to me. I made a fidget out of my pencils. I would dig under my nails with my pencils. When I got my ears pierced, I would take my earrings out and dig under my nails with my earrings, which is probably really unsanitary, but it's like, it was my thing. And speaking of like cognitive and verbal fidgets, one thing that I remember, it was not even a teacher, it was a peer called me out for, was humming. I was in 3rd grade and I was like humming during like independent work or something, and it was a peer who was like, can you stop that? And I was like, I was not even remotely aware that I was doing it, but sure, I will do my best to not do that anymore. So my fidgets were self-made. And so what fidgets do is, what they can do in education is they can give you a place to channel that extraneous energy so that you can then focus on your work.
According to a study, mindfulness training has been proven to be a promising psychosocial intervention in adults, as it is shown to improve executive functioning and reduce ADHD symptoms. Given this, I'm curious if the participants have any experience with teachers having them practice mindfulness, and if this benefited them in any way, even as a child. What are your experiences with practicing mindfulness as an attempt to help reduce the intensity of your ADHD symptoms? So mindfulness isn't like meditation, breathing exercises, yoga, like that sort of thing.
I try to be like, I guess, in tune with my brain. I still am working on it now, but like I'm trying to like let my brain rest when it needs to, because if my brain doesn't rest, then it gets worse. And do it in small doses, because whenever it's like really big, it stresses me out and makes me want to like panic. And also like what I'm still definitely working on is like not being like like as a kid, like, why can't I do this? Why can't I do this? I still do that a lot. So like comparing from that, and I think the ADHD definitely helped with that. So yikes.
So you're trying to like refrain from like limiting labeling yourself. Like,
yeah.
yeah. I mean, that's the thing that we learned in class that, like, students will do. They'll label themselves. It's called the attribution theory. So they'll attribute, like, a label, or they'll attribute a reason for why they're failing or why they're succeeding.
Yeah.
And usually it's very negative on them because they'll label themselves as, like, dumb or something. They'll be really harsh on themselves, and then they only see themselves as that. A study has shown that family school interventions for parents with children with ADHD have been proven effective, and that one of the components of family school interventions is the use of a daily report card. So I'm curious if our participants today have any experience with using daily report cards.
Showing them that I had homework assignments was stressful because if they don't know about it, then they don't know if I turn it in late or if I end up not doing it. So I really didn't want them to know, so that's why that was stressful.
Yeah, I could definitely see that. It sounds like they were, like, just doing too much. Like, it sounds like I could definitely see how that would cause stress. 'Cause, like, especially if you feel like you are fine with doing that, like, on your own, like, you shouldn't have to have your parents, like, check it off for you.
And I think it had to do with, like, my parents tried to help me a lot, and they meant well, but I think they scared me more than anything when it came to school, and that kind of environment and that kind of, like, the way they treated the subject of school was, like, rather than helpful, it was kind of harmful because I felt like I couldn't talk to them about it, and I just wanted to, like, do everything on my own.
Did any of your teachers ever help you set goals or teach you how to set goals? I know you had mentioned that they had you send home, like, what you needed to do for homework. But outside of that, was there any way that a teacher, like, really helped you understand the concept of setting goals?
I remember having this one teacher in high school when I was taking dual enrollment classes, and that was getting overwhelming for me. I had this research teacher who also had ADHD, so she understood a lot, and she gave me some advice. And the main thing I remember is when studying to do, like, intervals, so, like, work for 25 minutes and take a break for 5 minutes, and I've been doing that ever since, and it's helped a lot.
So you find that strategy, like, to be really beneficial to you?
Yeah.
Yeah, I've heard that's a really good strategy. I definitely feel like that's something that a teacher can, like, teach their students how to do from an early age. What was something you didn't have in your schooling experience that you think would have helped you?
I wonder how things would have been different for me if I had been put in front where I could have that engaging conversation with the teacher and my peers and feel like I was in the front and really contributing more frequently.
Well, now that I'm, like, now that we've talked about it so much, I feel like accommodations would have been really helpful. I will say my school, like, this doesn't really excuse it, but my school was, like, in the middle of the country and very small and rural and very yeehaw type town stuff. So they weren't the best to be accommodating to people, to anybody, really. So yeah, I think accommodations would have been nice. Better explanations would have been really nice. Sitting me in a place where, like in the front, around people who aren't super distracting would have been nice. Because, like, if I'm in the front, like, it's easier for me to focus because, like, I'm right in the front. But if I'm in the back, I'm going to space out more and I'm not going to be able to see better and stuff like that. And then typically people in the back always talk. So that's definitely, yeah. And then maybe extra time on assignments because sometimes it just would be a lot. And I would just, like, I think, like, in 8th grade, like, there was times where I just wouldn't do the homework because I couldn't sit down and do it. So I just didn't, which sounds bad because, like, I always, like, was like, oh, God, I'm such a horrible student. But it was just the fact that I could not get my brain to just sit down and do it. That's really difficult for me, and it still is really difficult for me. Like, I don't know why I can't just get it done.
So it sounds to me that, like, overall, like, in order for teachers to be able to make those accommodations, they have to understand both ADHD and the importance in those accommodations.
Yeah.
So I think that's, like, the first big step for, like, teachers, like current teachers and people who are going into teaching to understand that. So they understand their students and understand, like, or at least empathize with their struggles so they can make those accommodations.
Yeah, and I also think ADHD, like, although there's, like, very similar symptoms, I know there's some people who, like, deal with it differently and, like, it's different for them. So, like, definitely, like, learn how the ADHD affects the child, too, and accommodate what exactly affects them the most and go from there,